Right now, we're in the middle of a fentanyl epidemic in this country. This is the successor to the opioid epidemic in the country, and people are really familiar with how companies like Purdue Pharma and Sackler-owned enterprises may have really overstepped their bounds in over-marketing these drugs and the illicit perpetuation of opioid usage in this country. But that itself was also downstream of an FDA decision to remove Vioxx from the market altogether, when in fact you could think about limiting the use of Vioxx for people who Vioxx wasn't being overused. Absolutely, probably was. But to then take the knee-jerk reaction to remove Vioxx, if you're looking at the cost benefit for a country and for a patient population, you can't look at that decision in retrospect without looking at the opioid epidemic, which backfilled the loss of Vioxx from the market. And in turn, the backlash to the opioid epidemic, which now gives us the successor to the fentanyl epidemic, there are a series of unintended consequences for every one of those regulatory steps of intervention versus what an alternative world would look like is warnings through a private market mediated competitive system where health systems and universities and payers effectively blackballed the use of Vioxx, but for a few cases where the risk benefit of taking it might be better than actually moving to an opioid or now moving to even legally ordained fentanyl that were had far more addictive properties than Vioxx ever had. It's far from unclear that wouldn't have been a better state of the world than the state of the world that actually ensued, not to mention the billions of dollars or hundreds of billions of dollars of impounded cost to keep that current system of regulation intact. I'm curious what your take is on that example.
Well, that's a very interesting example. I hadn't thought about it the way you frame it, but I think you are making a really fair point that the FDA's deterrence of the use of the NSAID drug class, which is this different type of drug class, non-opiate drug class that treats pain.
Non-addictive. Non-addictive,
and
crucially for
non-addictive.
Our audience here, yeah.
Absolutely. Non-addictive, if taken in high doses, may cause some renal dysfunction. Vioxx had some certain, particular safety claims that people were investigating at the time. But the FDA did sort of as a class discourage the use of NSAIDs for pain, leading to the market for the opioids. And I think it's absolutely the case that the FDA's actions around opioids contributed to the opioid epidemic. They authorized every single one of the OxyContin, oxycodones that led most people to become addicted. Those drugs all went through FDA approval processes. I'll give one more example I think you might appreciate. The Biden administration, before they had seen the results of the randomized studies for Paxlovid, Pfizer's drug for COVID-19, had already committed to buy $5 billion worth of Paxlovid, and then they later gave another $5 billion. So we're talking about $10 billion in government payments for this product before they saw the data. The original data for the Paxlovid was in people who were at high risk of bad COVID-19 outcomes, who had not previously had COVID-19, never had COVID before, they're getting COVID for the first time, and they had never had any vaccine doses. So unvaccinated, didn't have COVID, high risk of bad outcomes. Under those conditions, at that time, against older strains of the virus like Delta, Paxlovid works. Pfizer had a different randomized control trial, which looked at vaccinated people, which looked at people who had maybe also had COVID in the past. Actually, no, I didn't have that. Vaccinated people in different strains, Omicron strains. And that trial was largely a negative study. That's the EPIC-SR study. But you saw this administration relentlessly push Paxlovid in low-risk populations, in part because they had already shelled out $10 billion for that product. That product likely made very little difference to the 20-year-old tech worker at Facebook who had a runny nose and took Paxlovid. It might have even made them worse off through rebound. That's a huge government expenditure, and that's the administrative state really trying to justify an error it had made in the past, which was not clarifying whether or not it works in low-risk populations before shelling out $10 billion. So I think it's a nice example where taxpayer money, so much taxpayer money is being used for something. It's costing us all. It's unclear if anyone's better off other than the shareholders of Pfizer.
Yeah, I think it is far from unclear. I think I would say that both for COVID-19 vaccination as well as in the case of COVID-19 vaccination, I think we can actually say we have decidedly people who are worse off for its existence. But even in the case of Paxlovid, it's far from clear, even as short-term therapeutic, what was far expansive in its use. And in the crucial part, I actually didn't know this. It's very interesting. Preordained that it was going to be. The government purchased contracts long before it was approved. It's kind of disgusting, actually, if you think about that. The standards that the FDA would normally apply to any other company that didn't have the political connectivity of that particular one would be treated in a very different sense. You don't even have the right to sell to privately contracting parties. Here, the government's going to pre-contract for it before we even know that, or even have a shred of evidence that it works, is disgusting, actually.